Today we'll discuss infant colic. So infant colic, it's a short topic. It can be asked in your university 5-mark question also. So it is a normal development, starting off with the introduction. It is a normal developmental process and it occurs usually between the age group of 1 to 4 months. This is a self-limited phenomenon that resolves on its own. So this is a self-limited one which resolves on its own. Okay. It has, when you're going in for the causes of the infant colic, so it is divided into two. One can be GI factors. Another can be psychosocial factors. Starting off with the GI factors, one is abdominal pain. Secondly, it is immaturity of the nervous system and the digestive system. So it is the immaturity of nervous and the digestive system. Next, going on to the psychological factors, first can be maternal anxiety. Secondly, it can be depression, that is maternal depression, when the mother gets postpartum depression and all, okay, or when there is an inadequate bonding between the mother and the infant. So when there is an inadequate maternal and infant interaction, these can be the one of the causes of infant colic. Okay, so that's a multifactorial thing. So the causes can be classified as these all. Okay, next we'll go into its diagnostic criteria. So going off with its diagnostic criteria, so everything must be present. So it must include everything. First, when the infant is less than 5 months of age. Second, there should not be any evidence of failure to thrive. So there should not be any evidence of failure to thrive. Fever and illness. Okay. Third, when there is a recurrent and a prolonged period of crying. So when there is a recurrent and prolonged period of crying, fussing and irritability. This prolonged period, the prolonged period can be defined as the infant has cried or fussed for more than or equal to 3 hours per day, for more than or equal to 3 days per week, for 3 weeks. Okay, so everything will be 3 here. So when you have to remember the infant colic as 3, that is 3 hours per day, 3 days per week for 3 weeks. Okay, next, going off with its management. So there is no gold standard treatment option. So there is no gold standard treatment option for colicky infants. Second, you can try. So the pharmaceutical agents that you can try. So the pharmaceutical treatment that you can try are that can be with only with a limited benefit in management. So the agents you can try are dicyclomine and simethicone. This can be useful for some of the infants. Okay, next, in recent evidence, it can be, you can use probiotic and symbiotic usage. So probiotic and symbiotic usage for the improvement of colicky pain. Okay, so this is the recent advance, in the recent evidence they have shown this. So this is all about infant colic. Thank you. Next video will make few of the classes from newborns, that is approach to a bleeding infant.